Hello everyone. So we are going to discuss hemodynamic disorders. In this first we are taking edema. Edema, it is accumulation of excess fluid in the interstitial tissue or intercellular compartment, either extracellular or extravascular. About 60% of lean body weight is water. 2/3 of body's water is intracellular and the remainder is in extracellular compartment. Only 5% of total body water is intravascular. Depending upon the fluid that is accumulate in body cavities, it is termed as ascites when fluid is accumulated in abdominal cavity. When pleural cavity is involved, it is known as pleural effusion. Pericardial cavity, if fluid is seen in pericardial cavity, then pericardial effusion or hydropericardium, and hydrothorax when fluid accumulates in thoracic cavity. Now, classification of edema. Firstly, based on distribution of fluid. When it is localized, it is known as localized edema, and when generalized, it is generalized edema, also known as anasarca. Now, on the basis of cause, the edema, it is either due to increased hydrostatic pressure. Increased hydrostatic pressure, it may be due to impaired venous return, which is due to congestive heart failure, constrictive pericarditis, cirrhosis, venous obstruction or compression. This venous obstruction or compression due to thrombosis or external pressure, lower extremity inactivity with prolonged standing, or increased hydrostatic pressure due to arteriolar dilatation in case of heat, due to inflammation, due to neurohumoral dysregulation or hypervolemia. Another cause is reduced plasma osmotic pressure. Plasma osmotic pressure is also known as oncotic pressure. So either due to increased hydrostatic pressure or reduced oncotic pressure. Reduced oncotic pressure is due to hypoproteinemia, which could be because of protein-losing glomerulopathies, cirrhosis, malnutrition, or protein-losing gastroenteropathy. Third cause of edema is lymphatic obstruction, either due to inflammation or due to any neoplasms like fluidy orange breast in breast carcinoma. It is due to lymphatic obstruction. Then post-surgical lymphedema or post-irradiation. And fourth is due to sodium retention. Excessive salt intake with renal insufficiency will lead to sodium retention, and increased tubular reabsorption of sodium due to renal hypoperfusion or increased renin-angiotensin-aldosterone secretion will lead to sodium retention and will cause edema. Another cause is increased vascular permeability due to inflammation, burns, or acute respiratory distress syndrome. Now, classification of edema based on the gravity of edema. It is either pitting edema or non-pitting edema. Pathogenesis of edema. So, edema occurs due to factors influencing the fluid transit across the capillary walls. The capillary hydrostatic pressure and osmotic forces, they are normally balanced. So, there is no let loss or gain of fluid across the capillary bed. This is the arterial end, this is venous end. Here at arterial end there is increased hydrostatic pressure, and at venous end there is increased osmotic or oncotic pressure that will balance the fluid transit. However, when there is increased hydrostatic pressure or diminished osmotic pressure, it will cause extracellular fluid to accumulate. Tissue lymphatics, they remove much of excess volume, eventually returning to its circulation via the thoracic duct. However, if capacity of these lymphatic drainage is exceeded, then edema will occur. So first we are discussing cardiac edema. How cardiac edema occurs or pathogenesis of cardiac edema. When there is heart failure, it will lead to chronic venous congestion that will cause increased hydrostatic pressure in venules. There is increased interstitial fluid, diminished absorption leading to edema. Due to heart failure, there is decreased cardiac output that will lead to hypoperfusion of kidney, that will increase the renin angiotensin aldosterone, leading to increased sodium reabsorption that will further increase sodium and water retention, that will lead to increased blood volume, further leading to edema. Hypoperfusion of kidney will cause increased ADH level that will increase sodium and water retention, leading to edema. Now, how renal edema occurs? Due to nephrotic syndrome, there is heavy proteinuria that will cause hypoalbuminemia. Due to loss of albumin, there is decreased plasma osmotic pressure that will lead to fluid accumulation in the interstitial space leading to hypovolemia. That will further decrease cardiac output, leading to renal hypoperfusion, increase renin angiotensin aldosterone level, that will further increase sodium and water retention, leading to increased plasma volume, increased hydrostatic pressure, large amount of fluid that move out in interstitial space, leading to edema. Pulmonary edema. Accumulation of fluid in the alveolar septum and alveoli is known as pulmonary edema. Initially, fluid accumulates in the alveolar septum, known as interstitial edema. Later, the fluid spill into the alveoli, leading to alveolar edema. Now, pathogenesis of pulmonary edema. Firstly, due to increased hydrostatic pressure. Causes of increased hydrostatic pressure are left ventricular failure, mitral stenosis, or mitral insufficiency. This insufficiency will lead to increased back pressure in the pulmonary vessels, leading to increased perfusion pressure that will increase the hydrostatic pressure, leading to pulmonary edema, interstitial edema, and alveolar edema. The cause of pulmonary edema is injury to wall of alveolar capillary that will lead to increased permeability of the capillary, leading to edema. Causes are ARDS, toxic gas inhalation or aspiration, aspiration of gastric contents, viral infections, uremia, shock, trauma, transfusion overload, drugs like amphotericin B, bleomycin, and radiation. Grossly, the lungs are heavy and dark in color. They are 2 to 3 times normal size. On compression, frothy blood-tinged fluid comes out. That is the mixture of air, edema fluid, and extravasated RBC. Microscopic examination, the alveoli, they are filled with homogeneous eosinophilic proteinaceous fluid material along with congested alveolar capillaries. This is the gross section of edema, pulmonary edema. On cut open, the frothy fluid came out. Interstitial edema is often asymptomatic. Frothy sputum may develop. Patient have cough or cyanosis. Cerebral edema. When abnormal accumulation of fluid occur in cerebral parenchyma, it is known as cerebral edema. Cerebral edema is of 3 types: vasogenic edema, cytotoxic, and interstitial edema. In vasogenic edema, edema occurs due to increased cerebral vascular permeability caused by disruption of the blood-brain barrier, either due to trauma, hemorrhage, infarct, inflammation, tumors, or lead poisoning. Cytotoxic edema, it is caused by injury to neurons and glial cells, mainly due to ischemia. Interstitial edema is caused by hydrocephalus. Fluid accumulate in the cerebral ventricles and paraventricular areas. Grossly, the brain is soft and heavy, the sulci are narrow, and the gyri are flattened with impressions of overlying bone. On microscopic examination, the space between glial fibrillary processes that become widened due to accumulation of edema fluid. Perivascular space is also widened by the edema fluid. Edema fluid could be exudate or transudate. Exudate fluid is due to increased vascular permeability, and transudate it is due to increased hydrostatic pressure. Etiology of exudate is inflammatory or allergic process, while transudate there is obstruction, CHF or renal failure are the main etiological factors. Protein contents are high in exudate whereas low in transudate. Specific gravity is high in exudate due to increased protein, whereas low in transudate. Fibrinogen level is high, so it clots spontaneously the exudate fluid, while fibrinogen is absent in transudate and it does not clot. And cellular contents, exudate it has numerous inflammatory cells, example neutrophils in acute inflammations and lymphocytes in chronic inflammations, while transudate fluid it is scanty cells. It has scanty cells, scantily cellular, mainly comprising of mesothelial cells. So the edema fluid could be exudate or transudate depending upon the etiology. Due to increased vascular permeability, exudate fluid, and due to increased hydrostatic pressure, transudate. This is all about edema. Thank you.